So thanks a lot, Dr. Vikas Singhal, for joining us. And Dr. Vikas Singhal is a senior doctor associated with Medanta Hospital in Delhi. Thanks a lot, sir, for giving us your time.
Most welcome.
So I would primarily start with a question that, you treat a variety of patients, and what are the main causes behind obesity? I mean, when people come to you of different age groups, what is the underlying cause behind obesity in people?
So that is a very broad question. There is obesity is multifactorial. There is usually not one single cause. When patient comes to us, very large aspect, of course, is the diet. The one, diet screening, diet correction. That is one of the cornerstones of any obesity program. But there are several factors. Patients may have some genetic problems that predispose them to obesity. There may be hormonal problems that contribute to obesity. There may be mental health problems that contribute to obesity. So it's a multifactorial thing. We have to assess everything in our obesity evaluation program. Dietitians are there who of course play a major role, who go over a very detailed diet screening, because in any obesity correction diet is one of the main stepping stones, cornerstones.
Right.
But what I want to emphasize is that diet is not all. You cannot say that somebody's diet is going to be a problem, that's the reason they're obese. There may be several issues, so we should not label somebody ki acha somebody is not eating right, so that's why they are obese. So we need to look at all the factors that may be contributing to obesity and correct all of those in a particular individual.
So, I just want to know whether, see, obesity in India has never been considered a big problem otherwise, if you take it socially, right? When you tell somebody that you might be obese, it's never taken that way, and they say they're from a healthy family, that's why they look like this, right? So, what kind of people are now approaching obesity as a problem? Are they young? Are they young people? Are they people from cities? Or you also have people from rural places who are coming to you?
So across the country, obesity is becoming more and more prevalent. Recent survey done by the National Family Health showed that almost 1 in 4 Indians is becoming obese, overweight or obese, which was previously 1 in 5 just a few years back. So almost 25%. Higher in urban areas, little bit lower in rural areas, more in women, even more so in younger age groups now, and childhood obesity. So, not just adults. Problem what happens is, if both the parents are obese, there is a 50% chance that the child will grow up to be overweight or obese. If one of the parents is obese, there is a 25% chance. So it is becoming, that is, more and more prevalent. We have all sorts of people coming to us, not just from urban areas, but from rural areas as well. More so younger people, younger generation, because they are becoming more conscious, which is a very good thing. I think in our younger generation, what's happened somewhere in between, the lifestyle has changed a lot, especially after COVID. People have becoming more overweight, more obese, but then also there is a realization that obesity is not just, it's not a cosmetic problem. Obesity can lead to a lot of health problems from head to toe, significantly higher chances of becoming diabetic, high blood pressure, heart problems, stroke, mental health problems. Several cancers are linked to obesity. So people are realizing that obesity is not just about, putting on a few extra kilos, or, obesity can be a major health risk. So I think several bodies are, WHO, several bodies are highlighting that we need to take care of our health. Preventive health is becoming more important, and people are becoming conscious. So yes, we are getting people from all sorts of life, all places, who are realizing that obesity needs to be addressed as a health problem. It's not a cosmetic problem.
Right, right. So, I mean, you pointed out an important thing that women and uh, young people are also more prone to it. Could you identify some reasons why is it so? I mean, one thing is that see, climate is playing a role. In big cities, people are not going outside because there's pollution. So, what are some similar reasons why? I mean, what are the other reasons why women are and youth are more prone to it?
So women hormonally are a little bit more prone to putting on weight, especially once in their after in their childbearing years. What happens is that after pregnancy, a lot of women put on weight, and they find it more difficult to shed off that extra weight. So, and the hormones play a major factor, where gradually they put on weight, and once they put on that extra weight, in our society still, a lot of the women, more from rural areas, are still housewives. They're still not, and even if people are working, the patterns of work maybe that they be working from home a lot. So it's becomes a cycle. Once you get
Right.
into that cycle of obesity, self becomes self-propelling. It becomes difficult to get out of that cycle. So which is what we are seeing. And once the adults are obese, the parents are obese, consequently the younger generation is becoming, and again, that's not just genetic, it's also the environment. Once the parents adults are obese, it's more accepted in the family that it's okay, it's a healthy child, it's okay. So there's several reasons, but yeah, it's becoming, from one generation to the next, it is becoming more and more prevalent. That is the problem.
And the availability of lot of, I mean, people are consuming processed foods. uh, uh, there are a lot of other issues which are leading to it, right?
Yes, our diet has changed a lot. Our diet used to be focused a lot of fresh foods, but yes, now with all the change in our culture, changing, easy availability of lot of processed foods. If I think about it, in my childhood, this is, say 25, 30 years back, we did not go out to eat so much. If you look at it today, people are eating out almost weekly, ordering out. If not eating, going out to eat, it's very easy to order and get food delivered at your doorstep. We never had those things. We were eating out on a occasion, on a birthday or some occasion. So eating out, and whenever you eat from outside, it is probably 2 to 3 times more rich in calories, and so you have to make that conscious choice. So yes, easy availability of processed foods, eating a lot more from outside, less and less of fresh foods and fiber, less of proteins in our diet. Our diet is, common Indian diet is very, in the north especially, is very focused on roti, in the south very focused on rice. So a lot of focus on grains and carbs, very less on proteins. So yeah, multifactorial, but yes, changing patterns, and deterioration in our diet has become a major factor.
So, and what are the other issues that people face when they come with something like obesity to you? I mean, what are the other diseases they are prone to?
Most commonly, it is diabetes. So, what we know is that type 2 diabetes, which is the common type of diabetes, almost 75% of that is linked to obesity. So, I emphasize this to patients. You may have heard of diabetes remission, which is a very common, popular thing these days. A lot of people talk about diabetes remission. Basically, what that is that if you lose weight, then there's a good chance that you may be able to stop the treatment for diabetes, at least temporarily. So it is only because it is directly linked to overweight or obesity. So it is, diabetes remission is nothing but taking good care of your health, where you exercise, you follow your diet, lose weight, and then you may be able to, lose weight, and you may be able to actually control your sugars just with the weight loss. So yes, the most common reason we see patients come to us with obesity, other health issues are commonly is diabetes. Then we also get a lot of patients who come with joint problems because of being overweight. They start having knee problems early on. So they have knee pains, start having trouble walking, and then it becomes a cycle where, because they're not able to exercise, they put on more weight. Um, so yeah, we may get patients referred by orthopedic colleagues because they may not be a candidate for knee replacement right away, because they may need to lose a lot of weight before they become candidate for knee replacement, or they may be able to delay it for some time. Fatty liver is another very common problem. Most people who get an ultrasound these days find they have grade 1, grade 2 fatty liver, which is basically just with a few extra kgs. What happens is the excess fat starts depositing on the liver.
Okay. Yes.
So yeah, people ask, so do I need a treatment for fatty liver? And it's very simple. For early fatty liver, all you need to do is lose some weight, and that fatty liver will stay under control. It will not progress. So
Right.
so so there's so many things that are linked to obesity. We don't realize, PCOD, infertility in women, often is related to obesity as well. So several aspects to it. So obesity, more commonly we see patients who come to us are nowadays are those who are having health issues due to the obesity, other than being overweight, the other health problems.
Other health problems. Right. So, obesity also comes with a different kind of stigma in the society, the way people see you. It also brings a lot of mental challenges. How, as a doctor, do you address these kind of issues?
Yeah, so we have to be, very conscious that especially when the patients come to us, they feel comfortable. They do not feel stigmatized, because yes, it is very common in society that they are called out names if somebody suffering from overweight or obesity, which again is a problem, because that may cause them to become depressed. They may go into that poor mental health state, and they may start having eating disorders. So yeah, when patients come to us, we have to tell them that it is really a disease. It is not a lifestyle problem. So it has to be looked at like a disease, where and it may be somebody may have an underlying mental health problem, such as depression or anxiety, that or eating disorders. So we need to screen out for those problems as well. They should not be afraid, or they should not be stigmatized to see a specialist. They need to realize that mental health problems are true problems, which
Right.
may need help from a psychologist, or some help with medication, until things stabilize. Yeah, we really need to help them see that it is a health problem that they need help with, and it's not their fault. We need to emphasize that it's not that just that they're not eating right. Sometimes we see parents who tell, in front of their children, they are saying, oh, they doesn't exercise, or he or she doesn't eat properly, doesn't exercise. So we have to tell parents to to get out of that habit. They have to be very careful. Only when they stop doing that will the child feel better or more comfortable to start actually treating that problem. Parents need to see it as a health problem, and then only the child will be we can help the child.
Right. So, but also post COVID, the way we work has changed. There's a lot of option to work from home. You are sticking in front of computer for 12 hours a day. How could corporates, government ensure that people are living a healthy life and they understand that obesity can be issue in future?
I think people are realizing that it's been a few years since COVID, and we have a lot of patients who come to us who say they put on weight since COVID because they're working from home and they have easy access to food. Their little bit of walking also is not there now. But yeah, I think the consciousness needs to come out on several folds. Yeah, people, companies have realized, industries have realized, individuals have realized. So yeah, I think that consciousness needs to be there. I think it needs to start at an individual level, that even if you're working from home, there are several things that can be done. In this very room that I'm sitting, I have I have a home gym that I assembled during COVID time. So there are ways, when we could not go out, there always where there is a will, there is a way. So you need to find that way. You can take short walks, breaks in between your hours of work. You need to find that time. Only that
Right.
individual can find that time, and it's not that difficult. Half an hour, 5 days, half an hour a day, 5 days a week. What I tell my patients is that some people say, "Oh, I don't have the time to exercise." Say, you will never, if you don't want to find that time, you will never find that time. I also have a busy schedule, but I may find that time very early in the morning, 5:30 or 6 o'clock, whatever suits my schedule. So you have to find that time. There's no, unless you want to age very early, right?
Right.
So somebody has to find. You don't want to have health problems. There's no point working 16 hours a day and then becoming, have a very short working life. So I tell people that you really have to find that time for yourself, and everybody, however busy, whatever position they're on, can find that time. And it's not too difficult to find that half an hour, 40 minutes, and it doesn't have to be 40 minutes at a stretch. They can do 20 minutes in the morning, 20 minutes in the evening. Take breaks in between. Sleep hours are very important. Don't be sleep deprived. Getting into a schedule. Eating habits, you can be very particular that eat lots of salads, include. So there are ways to work around it, but that consciousness needs to come from the individual. And one
Well,
more, the don't let it get out of control. uh, Work early. I tell patients that when patients come to me for when they come to us, they are in a full range of spectrum of things. We may have patients who are just 10-15 kg overweight, who've realized it early. They only need diet and exercise, help with diet and exercise. Then there may be patients who then are 20-25 kg excess weight, who may need help with some medication also, apart from diet and exercise. And then we have patients of 40-50 kg excess overweight who may need help with bariatric surgery.
right.
So I tell people, realize it as a problem earlier on. Don't let it get to a point where where it's going to be more and more difficult for you. So be conscious. Only 10 to 15 kg, when you are put on that extra 10 to 15 kg, start seeing it as a problem right then. That is, I think, the awareness that we need to create.
Right. And also choose and talk to an expert rather than relying on these online uh, things which are being sold without any credibility.
Absolutely, yeah. There's so many online, things. So yes, yeah, that's a very valid point. That, yeah, take proper help. Take proper help.
Thanks a lot, Dr. Singhal, for giving us your time. And as these things proceed, we'll be coming back to you on such issues at a regular interval. Thanks a lot.
Okay, was fine. Thank you.